Hi, we're here today. I'm Michelle Wieber,
Greg Schroeder, Wieber Physical Therapy.
both physical therapists, and Greg has a weightlifting interest, and I'm also certified as an athletic trainer, and we are here to talk about the knee today, right? All right, Greg, so I have some questions for you.
All right.
You ready?
Yep.
So why would somebody come and see a physical therapist instead of just getting exercises off the internet?
Well, I think the biggest thing for that is because we know everything on the internet is true.
Oh boy.
So there's always technique involved, and we have to make sure that whatever exercise, even if it's an exercise we give them, we need to make sure that, number one, they're doing it correctly, they're doing enough of it, or not doing too much of it. And they're doing it on the specific number of days, so they get rest in between. So there's a lot more to what we do here as far as exercise goes than what you can find out on the internet.
So really individualized, right?
Absolutely.
Yeah, one of the things I think we do is we look at a person and we evaluate exactly what's going on, not only in the knee, but kind of throughout the body.
Well, yeah, I mean, we've got student athletes or even, younger, all the way up to grandma.
Right.
So there's a wide variety of things that we have to look at.
And knee pain is really common. And so sometimes knee pain is because somebody's really weak in their core,
Hips.
their hips. Yep. Sometimes it's because they've got their foot overpronates and the knee collapses. And what other things do you look at?
Well, just general mobility. So tightness, hamstring tightness, IT band tightness, glutes, just tightness.
Yeah.
Gastroc tightness if we're looking at more in the foot area too.
And all those things can limit how the knee moves and when we're trying to do functional activities. Yeah, for sure. All right, so one of the things that what I like to think about is, does this person with knee pain have too much mobility or do they have too much stability? So are they too weak or are they too tight? And that can be all along the kinetic chain from the foot up, right? Yeah. So what would you say to somebody who came in and said, well, I need 3 things or 4 things that I can do myself at home? What would be your top recommendations if they're coming in with a hot, sore knee?
Ice.
Ice.
Ice is always number one.
Yeah. Okay.
I don't think you can ever go wrong with ice. I always have people ice. Stretch. Comfortable stretching. Stretching always has to be comfortable and sustained. At least that's how I see it. And then very, very basic stabilization exercises that will not irritate the joint.
Okay.
So that's our quad sets and our straight leg raises, which use the muscles surrounding the joint but don't actually create movement in the joint, so we can take care of some of that irritation.
Okay, I agree. I'm ice all the way. I have some athletes asking me right now about heat. Isn't heat better? And I really believe that in the first 72 hours, icing is the best way to go.
Heat always comes up. So my look at that is, if it's outside that 72 hours, it's become more of a chronic issue, then I say you can heat it up, but then do something with that. Because if you are experiencing some discomfort and you heat it up, there's going to be an inflammatory process, which if you just heat and heat and heat, it's not going to get any better. But if you heat it up and then use it, do your stretches, do your exercises, and then ice it down.
And ice it down again, yeah, good.
I think that's my look on how heat should be used.
So I have people coming in all the time. They've been diagnosed with knee arthritis, and their impression is that life is over. My knee has arthritis. Now I might as well get signed up for a knee replacement. What do you think about arthritis?
After 1 million repetitions of squats, I will guarantee you I have arthritis. So I guess you got to use it or you're going to lose it. That's the bottom line. Yeah, there'll be some days where it's uncomfortable, it's painful. Maybe those days we don't do as much. But if you just stop because somebody told you had arthritis, that's it. You're done.
Right. I think it's more of a rusting out than a wearing out kind of situation. So if you just sit around, motion is lotion. If you're not moving, you're gonna be in trouble.
Yeah, absolutely.
Yeah, there's actually, I think, going to be on our Facebook page soon a picture of somebody who's 70 who works out and somebody who's 70 who doesn't work out, and it's their thigh muscle what a difference, right? That means that person can move and the thigh stays strong. Okay, so we got somebody with a sore knee for sure should be icing. They need to keep their knee moving, and they need to make an exercise choice that doesn't aggravate, right?
Yes,
Doesn't aggravate.
exactly.
So what can they get from a therapist, I guess, is one of the questions. What would be like, I don't know, the top 5 or 6 things that you think a physical therapist could do that would be different than what they could get off the internet?
So one of the things I like, especially if somebody has tightness, hamstrings are horribly tight most of the time when people come in. Yeah, we can show them. My favorite hamstring stretch is just to get the legs straight out there and sit nice and tall and just gently push the chest forward until you get a nice pull. Well, that's great. They can do that as many times during the day as they want to, but that just may not be enough. So one of my favorite stretches is the contract relax, where I will have them actually pull down into my shoulder. They'll hold, then I'll have them relax, and I'll move them into a stretch. And we repeat that process, and we can generally bring them into a more flexible position. And that's something you can't really do on your own.
Yeah, and we use that all over the body, so we can stretch the quads that way. And yeah, one of the other things that we like to use is also electric stim. So if a quad isn't firing, show off a little leg here. So if a quad doesn't fire, or it's just barely firing because of pain or surgery or swelling, then we can hook up the electric stim unit.
And that will help the muscle fire. Unlike what you might see on late night TV, where you can just slap those on the abs and develop that six-pack, that's not how it works. It helps the muscle fire. I believe, if I remember my education, that even at most, if we electrocuted her, she could get about 70% of the strength you can get with a volitional contraction. So it's helpful, but it's not everything. So that's why we use that to encourage her to be able to contract the muscle.
Yep. So now that's just the machine doing it. And it feels like buzzing. You can see it wiggle there. And now I'm going to add my own contraction with it. And
So
then I'm going to rest.
if somebody's having a hard time even feeling that muscle, that will start to give them that idea of, oh yeah, here it is. And then as the E-stim kicks in, they can start to contract. And that's great. Look at that.
Yep. So research studies done have shown that this can cut rehab time by about 60% for that quad muscle. Yeah. So I like Stim too. Not painful. And actually people can get really home units now that aren't too bad once they're trained in how to do it.
Absolutely.
And do it at home. So the other thing we like to look at is, what is actually causing the knee pain, right? So maybe it's a kneecap that's
Not tracking
properly.
This is another flexibility issue, perhaps.
Mm-hmm.
IT anti just coming from the hip down the side of the leg can pull that kneecap laterally and down. And so what we see is, instead of having a nice edge to your patella, there actually isn't an edge. It's kind of mushed down into the side of the leg. And so what happens with that then, as we flex and extend the knee, well, if you had heard that or felt that, my knee pops, because there's a track that kneecap is supposed to follow in. And if it's being pulled out to the side, that can become very irritable and create pain, swelling.
Yep, and sometimes that's related to the IT band, the tibial band. So sometimes we'll use the roller or some cupping tools.
So easy at home. If you have a roller, fine. If you have a rolling pin, that works just as well. And it's just a matter of just running that up and down the side of the leg, just to create a little more blood flow through the area. And then we can go ahead and follow that up with some stretching. You've probably seen people, if you go to the gym, on the floor, rolling the hips over that, same thing. They're just trying to stretch and roll through that IT band.
Yep. And then we can do some taping for the patella. So it's called Mcconnell Taping, and it's was developed by a woman overseas, and she's got her own specific tape. So you can't do this with
Duct
tape that's duct tape. You can't do it with athletic tape. And see if my kneecap is not quite tracking correctly. The tape adds a little extra pull, and you have to be sure you get little dimples on the side. But there are about 5 different ways to use this type of taping technique, and it should be less painful after you tape it.
Just this morning, I had a girl who has been having trouble running. She got referred by the doctor, and they just said she was weak. Well, she wasn't weak, she was painful, and so the pain in the knee shut the quads down. And that was because that kneecap was tracking off to the side. So put some tape on her, and after just 3 treatments, she ran today on the treadmill. She was just like, wow, that was
great.
as simple as that. So over time, she will get strong and stretched, and she won't need the taping.
And then you get rid of the tape. Yeah, it's great. It's a great option. All right, there's also something out there, patellar mobilizations we talked about. So not only would you use tape, but in the clinic we probably would move the kneecap and make sure it moves in all the directions that it's supposed to be moving in. And mine has a little noise, old gymnast that I am. Noise probably like yours. Then we will sometimes put somebody in an orthotic, right?
Yep, correct. If there's a foot problem, absolutely.
So if they tend to lose their control of their arch, maybe exercise for that, and maybe an orthotic, depending.
But if we look at what happens, even as she's sitting there, if you see that fall in, what happens at the knee? Now we're putting more stress to the medial part of the knee. And then if we look farther up the chain, we're putting more stress on the outside of the hip. So we're going to create a whole mechanical problem just from that one little thing happening at the foot.
Yeah. So you can't just treat the knee.
Can come from anywhere. Yes.
The whole system. Great. Okay, so arthritis is not
it's not the end.
It's not the end of the world, and there's a lot that physical therapy can do to help you, not only with getting your function back, but we should be able to tell you why you're having the pain.
Absolutely.
Through the evaluation, a thorough evaluation.
And you will get a good exercise program that you'll be able to take with you outside of therapy. And that's really, your homework. And that'll be the biggest part of getting yourself better.
Yeah, great. Well, Greg and I would love to see if you've got knee pain. Give us a call if you have a question. We actually do offer a 15-minute free phone consults if you just want to discuss what's going on with your knee. And hope it's a great day.